My name is Jude Daya. I'm a transgender man and genderqueer, and I'm currently studying a master's in psychological research at the University of Cape Town. And my research looks at transgender men's experiences with mental health care services in South Africa. And my tech issues are not working so well. Um, so why I chose this topic is my personal experience being a trans man in South Africa. And when I started this degree in 2020, I really struggled to find research about trans men and mental health care in the country. And actually, the only piece of writing I could find by or about trans men specifically was London Mabenga's memoir from 2018 called Becoming Him. And I've used mental health care for most of my life, so it felt a bit obvious to choose my lived experience as my research focus. But I realized that if I couldn't find any information, it was likely that others couldn't either, and that they would therefore wouldn't have the background knowledge to properly treat us. So someone had to talk about the difficulties we're experiencing, and that someone had to be me. Excuse me. And the CISA's guidelines about working with sexually and gender diverse people had come out in 2017. But when I conducted the research interviews in 2021 with 17 trans men and trans masculine individuals, that didn't seem to have really been adopted by most mental health care professionals. And since then, I still haven't seen that much research about trans men specifically in South Africa, outside of some medical clinical contexts around research around like cervical cancer and that kind of thing, but definitely not in the mental health care context. So I've seen a lot of research by cisgender people speaking about us or for us, but very little from a trans perspective about our own mental health. Doing insider research and speaking with other members of this marginalized community means that I can get our stories out there for others to hear. But especially early on in my research, I questioned myself a lot. We're taught as that researchers are these detached, objective observers, just analyzing data, and that subjectivity is a weakness. But by its very nature, my research has to be subjective. I can't separate my identity or experiences from my work, and to try to do so would be disingenuous. My first point of reference in analyzing the experiences of people like myself is not academic literature, but rather my own life. So I specified in the interviews that since I was focusing on mental health care, I wasn't going to ask about medical transition, but it is something that all 17 participants brought up and something that almost all of them wanted. It's worth noting that obviously not all trans people want medical transition, but for these participants, it was quite important. But people had experienced a lot of barriers to accessing this healthcare, particularly financial and geographic. I interviewed people from on Zoom for people all over South Africa, and for those in major cities, it was like significantly easier for them to at least try to be able to access the healthcare they needed. Whereas for people living in, say, the Eastern Cape, it was just basically impossible. And knowing that transitioning was an option, but being unable to access this transition caused a lot of emotional distress for many participants. This is the case for me as well. I'm 30, and I knew I wanted to go into testosterone at age 15, but was only able to start in my mid-20s. And like this one participant said, that in between stage of knowing that you're trans but not being able to change anything was very difficult. Access to hormones and surgery is still generally gatekept by the mental health care profession. Like several participants had only seen a psychiatrist to get a referral letter saying they're supposedly mentally stable enough to start hormones. They hadn't actually needed mental health care services for any other reasons. So this adds another substantial financial barrier to accessing transition. But it's also not guaranteed that the psychiatrist or mental health care provider one sees will be trans friendly or even know anything about trans people. And while hormones and surgery are definitely a clear part of gender affirming physical healthcare, I think medical transition is also a key aspect of mental health care, since transgender people's mental well-being can be so deeply affected by it. So when it comes to gender affirming healthcare, a lot of the focus has been placed on alleviating trans patients' gender dysphoria. And in a mental health care context, it makes sense to focus on treating distress. However, several people I interviewed described how healthcare providers assumed that all mental health issues they struggled with were related to being trans or were just gender dysphoria. This just further pathologizes trans individuals, and it also means that people weren't getting help for the problems they'd sought help for in the first place. And in some cases, like for the two participants who had eating disorders, their illness was related to gender dysphoria, but this generally wasn't the case. Most participants had struggled with like depression and anxiety. Others had had PTSD, substance abuse issues, bipolar disorder, or schizophrenia. But generally, these weren't actually directly related to being trans. And I feel that there needs to be a shift from focusing on trans distress to trans joy. Being trans should not be defined by misery. Not all trans people experience gender dysphoria, and to me, gender euphoria is what defines being trans. And participants described how being perceived as male helped their confidence, how they had decided to transition based on their own happiness, even if they received backlash from their families or loved ones, or if they were rejected by the families. Some people were just completely cut off by parents because they came out as trans. And they also talked about how other trans men had helped them in their process and how they had helped others. And often this was like around practical advice around, okay, if you want to get top surgery, this is the surgeon you need to talk to, this is the person you need to avoid, this is how the whole step-by-step process works. Because that information hasn't, as far as I can tell, been made clear to trans people generally in South Africa of like how do you go about transitioning in any form, whether it be legally, medically, socially, in any case. Um, so one major issue that participants brought up was that of education. Healthcare providers not having even like the basic knowledge about transgender people. And they wanted medical practitioners in all fields to educate themselves and not expect trans patients to do the teaching. Um, Several people talked about having to educate healthcare providers about things like the difference between sexual orientation and gender identity, or, really quite fundamental things. There were also issues around language use, like misgendering and dead naming and using incorrect language, like saying someone is transgendering instead of transitioning, even after the participant had corrected the psychiatrist or whoever it was. Um, it, excuse me. The participants had also seen therapists who tried to persuade them that they weren't really trans, or that they who tried to sort of talk them out of it, or see it as a sort of last resort. If you really have to be trans, then fine. Um, and the few therapists who had seen other trans clients would also compare the participant to these other clients, and then either deem them not trans enough in comparison because their dysphoria wasn't as bad and they weren't um, trying to deal with it in the same kind of ways, or they generalize from one trans patient to the next. So, for example, like one participant had seen a therapist in their teens, and that therapist had previously seen a trans woman who was in her 30s, and this therapist tried to apply the same kind of logic and advice to a teenager as they would to an adult woman, which just obviously was not helpful in the slightest. So I can only speak from the patient side of things, both from my research participants and my own experience, but not from the side of the healthcare providers. Um, and I think future research needs to look into the perceptions that mental health care providers have of trans men and trans masculine patients, because I feel that as a population, we are quite invisible. It's I often encounter people who don't really understand that being a trans man is even a thing. They don't understand it as a concept. And I know for myself, I've had to do a lot of kind of trans 101 of just explaining the absolute basics to healthcare providers and to people generally. Um, so we need to bring together what patients are experiencing with healthcare providers' perspectives on their needs, and to actually come to a meeting point of this is what I think I need, this is what you think I need, and this is what is actually going to be the best treatment for me going forward. And one thing I've noticed is that like I've seen posters up at like pharmacies or medical practices about, about the rights of the patient, about what the patient can expect and their responsibilities. And I think something like that would be really helpful for in a mental health care context as well. as a general healthcare context for trans patients and their healthcare providers. Um, and so that you can know, for example, that you're going to see a psychiatrist and there's a post-prep saying this is a trans-inclusive space and your pronouns will be asked for, and on the intake form you'll be able to put maybe your legal name, but actually the name you prefer. Um, so there's some small changes that can be made there that would, I think, help make trans male patients feel a lot more welcome in a lot of mental health care spaces and a lot safer. And yeah, that is about it from me.